Okay, hello. I'd like to introduce myself. My name is Clifford Nathaniel. I'm a clinical manager for Pathways Behavior Health Center through West Tennessee Healthcare. My office is in the Dyersburg Center, so I drive to Dyersburg 4 days a week, and I work at the local office here. I have a master's in counseling. I have a master's in counseling psychology. Also, I'm licensed as an independent practitioner in psychology. And I also teach psychiatric nursing for Jackson State Community College. I've been teaching there 15 years. Today's presentation is actually for parents parenting teenagers or troubled teens or teens and youth that have some type of mental, emotional behavior issue. So thanks for choosing to select this course, and we're going to get started. When you're looking at troubled teens, you can look at teens, say certain things about their behavior is typical, or you can say these behaviors are something that's getting your attention, what could be considered a troubled teen. But when you look at the characteristics of teenagers, teenagers are real egocentric. They have these imaginary audience. They have these personal fables, and they have these different types of illusion as if they're vulnerable. They're only concerned about their own thoughts, or they're only concerned about their own feelings. They actually believe that their peers and outside families or outside social groups are always paying attention and actually watching them. This person of a fable thing believe that they're actually unique and actually that they're invisible. They can actually do things and they can actually escape certain type of consequences. But when you think of these illusions, they're real sensitive, they're hypersensitive, they're driven by their emotions until they actually develop different types of thought processes and different types of ways to make a good decision, use good judgment. So, but when you look at what caused teenagers to have some type of mental or some type of emotional issue or some type of behavior issue, has a lot to do with biology. Biology has a lot to do with the genes that teenagers and our children and our youth inherited from their parents. Has a lot to do with the social environment that these teens live in. But if you look at teenagers that are not receiving any type of help, you could say that these teenagers suffer from a lot of pain. These teenagers are actually failing in school or failing in relationships, or they're failing in some part of their life. If you look at teenagers who are actually receiving some type of help, dealing with some type of mental or emotional behavior issues, they achieve better academic-wise. You notice that these teens actually use a less substance for as any type of alcohol substance, any type of marijuana, any type of pills. These teens have a better chance to improve their future outlook based on getting some type of interventions or some type of assistance. Teenagers who are suffering from some type of issues, you notice that they increase tardiness for school. These symptoms can cause them to actually be sick a lot, and then you can pick up on, hey, something is going on with this child because they're always tarded. This child is always absent. They're always coming up with excuses so they won't actually have to attend school. So when you look at what's typical versus a troubled teen, think about adolescent development. It's a period of rapid changes, transition. There's a lot of challenges that they face. They're actually trying to fit in. They're actually trying to develop their identity. They have all of these demands on them. Demands from school, demands from home. Sometimes other issues that these teenagers are dealing with. They're dealing with violence in the home. They're dealing with families that's going through changes for its divorce or other type of things that's putting them in situations where they're easily influenced or they could actually start having problems. But the bottom line is that teenagers show certain type of changes in their moods. They show types of anxiety, a lot of distress, and a lot of impulsive behaviors. And this is typical, though, when you pick up on these type of symptoms. But look at changes in their mood. Marked mood changes or changes in school performance has a lot to do with their inability to cope, has a lot to do with physical complaints, has a lot to do with sexually acting out inappropriate, has a lot to do with depression, has a lot to do with alcohol or use of drugs, has a lot to do with intense fear of becoming obese, has a lot to do with nightmares, has a lot to do with threats to themselves or other teenagers who become cutters, has a lot to do with self-injury and cutting, has a lot to do with frequent outbursts, impulsive anxiety, when you're picking up on things that this is not normal. And also, a lot of girls, they're threatened by these different stressors that they're dealing with, and a lot of frequent running away. Boys also run away when they're dealing with a lot of mental, emotional issues. Also, a lot of aggression in boys. That's about control, the anger, the impulse control issues they're wrestling with. Unusual behaviors. But the key is to recognizing and deciding to do some type of an external referral process. So the question is, when help is needed beyond our school and our home? A lot of families actually talk with their PCP. They talk with a lot of the youth department in the churches. Teenagers talk with their friends, or parents can talk with friends. Or you can actually look at local mental health centers such as Pathways that's through West Tennessee Healthcare. But the initial interview, when you're actually picking up on a child, the interview normally look at what's going on with the parent and the child. They look at a lot of the history. They look at the child education. They look at what's going on in the home. And they look at what's going on with the parent, any issues during the pregnancy period, the medical history. They actually look at the child job history, goal, any problems with friendships or drugs. We're trying to identify, is this normal or is this not normal? And they do a lot of behavior observation. This observation is structured or unstructured. They look for things that happen before the teen starts showing these issues. It has a lot to do with the antecedent, has a lot to do with the behavior, and all this is tied together into the consequences. Parents, it's something to think about a functional assessment. When you look at the social behavior parents, and you also look at the emotional and psychological, and you look at is my child functioning okay in these areas? It's okay to do self-monitoring. You can monitor child, or you can teach your child how to monitor themselves for a school and relationship to pick up on any type of concerns. The DSM-4 is something that we use at the hospitals to pick up on, is this normal for my child, or is this a child who's a troubled child? And when you look at parenting through understanding, if you look at these blocks here, parents, this is basically the child here. And the child needs centers around love, a belonging to peers and friends, has a lot to do with power, self-efficiency, has a lot to do with fun, has a lot to do with control and choices. This is the journey of your child. Kids suffer from the fear of rejection from their peers. That has a lot to do with blending in or fitting in. Kids suffer from performance failure. They're so afraid that they're going to fail, and they're so afraid to change. And a lot of kids are afraid to actually be successful, parents. So make sure that you focus on these needs that's attached to your child, and it has a lot to do with your child's overall identity. When you look at things that you consider that are not normal, parents, kids internalize things that are going on with them. They internalize a lot of disruptive things. They internalize a lot of negative energy, and you can pick up on some type of behavior problem, a possible attention deficit issue, or possibly a child that's opposition defiant, or a child that's showing characteristics of a conduct disorder. Kids are sad and withdrawn. Kids actually are hopeless sometimes. Kids feel weak, and they don't have power. They basically feel that they can't help themselves or the situation. If you look at the frequency, kids show a lot of anxiety disorders. Kids show a lot of mood disorders. And kids show a lot of disruptive disorder. One thing about these disorders, anxiety has a lot to do with uncertainty or things that they can't predict. Mood disorders in your child has a lot to do with some type of change or some type of loss. And disruptive disorders, parents, has a lot to do with the child that's acting out to try to gain some type of attention. So look at the characteristics of kids who have some type of attention issue. It's basically they can't focus, they can't follow instruction, they're unorganized, they're easily distracted, they're easily hyperactive, they can't play quietly, they talk a lot, they blurt out answers. This is the child who's having problems with their mental processing. So you can see the poor attention. You can see that attention deficit comes with depression, anxiety. You can see that kids also troubled by post-traumatic stress disorder or some type of social issue. Look at the opposition to child. If you have a teen that you say, something is going on with my child is real defiant. They're real negative toward me. They're real hostile. They lose their temper. They argue a lot with parents or teachers. They have these refusal behaviors. They actually do things out of resentment. This is a child who's actually dealing with some type of emotional issues, parent. What about the conduct disorder child? The conduct child, parents, is more serious than opposition defiant. This is the child that's a hostile, a dangerous person. They're very destructive to self and others, to property, to animals. They violate rules. They have a lot to do with control. Trying to identify this child is the key, parents. Because based on the conduct child, at the age of 18, the child actually start becoming antisocial, and they actually start doing things that can really mess their lives up and also mess up the family system. Let's look at the anxiety child, parents. I label this anxiety and fear disorders through the eyes of a child. Children are real anxious and nervous. Children have this internal self-talk that creates anxiety. Kids have all these irrational, or you can say irrational and fearful thoughts. It could be about the social system. It could be about their family system, about grades, about blending in and fitting in. And you can pick up on an anxious, nervous child. Look at how this troubles our teens, though, parents. Troubled by their processing. I see a lot of kids with the anxiety, the substance, kids with the depressive disorders, parents, and then the borderline, and these stressors actually put your child at risk for possible suicide. So if you can pick up on these symptoms, parents, you can say, my teen is troubled. It's possible that I need to do a referral so we can prevent this child from engaging in any type of suicidal behavior. So look at some of the anxiety disorders. These are just terms so you can be familiar with childhood anxiety. Generalized anxiety, panic. Kids have a lot of social phobias, parents. They have specific phobia. They have a lot of obsessive things that they're doing. And these are your anxiety disorders that they're actually internalizing due to a lot of negative energy, parents. And look at some of the clues that you can pick up on your child. The child is very fearful, shortage of breath. They have problems separation from parents. They're real scared. They have sleeping changes. They're real shy parents. They complain about dizziness. They don't like going to school. It could be bullying going on at school, and that can pick up on, I have a troubled teen. They avoid being assertive. They're socially withdrawn. These are symptoms just to pay attention to say, my child might be showing some anxiety, or my child might be showing some type of depression. So let's do a reality check, parents. We're going to use Windglass's model to reality therapy and control. So my question, parents, is I'm trying to encourage you, parents. I want you to be more engaging with your child and ask these questions. What is my child doing? Okay, what is my child really doing? This is the question to focus in on your child when you pick up on a troubled teen. Your relationship has a lot to do with the influence in your child. The quality of the relationship has a lot to do with your connection emotionally, mentally, or psychologically with your child. So you have to really look at different parenting styles. Has a lot to do with your developing teen or troubled teen. You have your authoritarian style parent. You have your authoritative and your permissive style. The authoritarian parent is the parent that make rules, that they expect the kids to be obedient and don't question them. These are kids that are actually pushed, and these are kids who feel control, and they normally develop some type of internal disorder in which is anxiety or it's depression. If you look at the authoritative parent, these are the parents that set high but realistic and responsible standards. Your child can feel that you're connecting with them, that you're trying to foster their independence, that you're trying to help them to grow and become a responsible child. Permissive parents, I warn you, permissive parents, if you allow your child to basically just do whatever they want without rules, parents, without any demands, to actually any consequence, these kids are allowed to basically be free and actually roam the streets and the malls without any type of supervision. And these kids can grow to become very immature and very impulsive if you are a permissive parent. My only concern, parents, to point these three styles out is just to get your attention to look at your relationship with the child. And that moves us toward our vision, parents, to actually create a map. And the goal is actually to see what's going on with our teenager. That's my goal. What's going on with my child? What's the direction of my child? What's the vision of my child if you pick up on a child who's typical or a child who's troubled? So we're going to focus on teaching control stereo parents. The goal of our child is to become successful parents. And if you pick up on a troubled teen, this has a lot to do with the stress that your child is under. If the child is under a lot of stress, the child could be moving backwards, and backwards to actually be failing parents, developing a failure ID. So the goal is to pick up on the stress the child is dealing with based on what the child is doing, which is the direction of the behavior parents. Also, how does my child operate? Okay, what are some options that I can talk to my child about? Okay, what can I do to increase my child's overall intelligence? How can I help my child to explore different ideas? Okay, what are the needs of my child? What do I need to evaluate? Okay, what are my personal goals for myself as a parent based on what are the goals for my child? Okay, what's going right in my child? So the goal is to stop and think about what the child is doing, parent. And the goal is to help our child to become successful and to create a successful identity. Cool counseling, what does the child want? Are some things you can do. Okay, what do I want, or what do I want to be, things that you're trying to engage with your child? Okay, what is my child doing? Okay, the direction, what are they doing? Is it working, parents? Let's do some evaluation. Does your child's present behavior have a reasonable chance of getting what the child wants or what you want for your child? So we have to make sure we engage in setting time aside to do a lot of planning, parents, to identify ways to help our child fulfill their needs or their wants based on Windglass' a WDE approach to working with children who are actually considered tough kids. Teaching teens to balance. The art of balancing, parents, is using great skills. I call it the characteristic of a parent who's a great leader. Being genuine with your child, respecting your child's independence, respecting the needs of your child, working on being non-judgmental, actually having a warm and concerned and active, involved personality, parent. And we can actually save our troubled teens. Look at this, educational goals for the future. We're going back to Glasser. This is the most effective model to helping our teens develop. We're focusing on your child personal goal or your personal goal. Okay, what are you doing right now with your child, or what is your child doing, parent? Because we're focusing toward the target. Okay, what's going on? What are you going to do with your life? This is something you're going to ask your teen. Okay, you want to go to college, you want to do this. So what are some of your options? What are some daily opportunities that you can actually start working on to move towards your goals? Okay, what alternatives are available for college, parents? What alternatives are available for parents and families to be more supportive or to make sure that kids are associated with kids or friends who are actually moving towards similar goals? What are some of the laws? What are some of the values that the family system has a lot to help the child to achieve their goals? So what are your plans to be a success? This is a model, parents, that I'm suggesting, and I'm highly recommending that you use the Windglass approach when you're working with a troubled teen. Dr. Whaley talks about the 7 C's, parent. These are another option for your child. Make sure your child realize these are the 7 things that they can utilize to actually perform better in school, relationships. Make sure they work on time management. Make sure they have great concepts, great ideas, and great images in their mind of basically what they want to be, what they want to become. Make sure they have great context, parents. Make sure that the friends that you see your child is associated with, those are healthy and productive contact. Make sure your child understands what causes certain things to happen, and make sure that you're involved. Sometimes not being involved or actively involved with the child, that could be some of the causes that's causing the child to act out. Make sure that parents, that you have your commitments, that the child know what their commitments are. Communication is a key, parent. Communication is a two-way process of sending and receiving. And make sure, parents, that you know what your concerns are for your child. And also make sure that your child talk about things that concerns them. Sean Covey uses 7 habits for your teen to function more effective. Teaching your child to start utilizing time to be proactive. Start planning ahead of time. Start planning ahead of time. Ask your child, like, what's your goal? So the goal is to go to college, which would be the end. So what can the child start doing now, Monday through Sunday, utilizing their time to actually create things? Teach your child the importance of putting first priorities first. You know, think win-win. How can I help my child to win? Okay, how can I be more involved with my child so that I can win? And this is what Covey talks about, think win-win for you and for your child. When you have a troubled teen, seek to understand your child first sometime. And then see where the child listen and say, understand what's going on in you. So you're seeking to understand, and then you're seeking to be understood. You're trying to center, you're trying to blend, and you're trying to have that connection with your child so that you all can work together. And you sharpen the saw is actually you're sharpening your communication skill, and you're helping the child to develop their social, mental, and emotional functioning skills. These are 7 habits for highly effective teens. This book you can buy it at Books A Million, and also the book here you can buy at Dr. Whaley at Books A Million also when you want to use the writing the 7 C's. So we're moving toward the end, parents. If you think about the typical teen, which is things that kids normally do based on their developmental stages, and you think about a troubled teen in comparison to a typical teen, you have to pick up on kids with anxiety. You know, they're worrying, they're anxious, they're having stomach problems, a lot of headaches. You can pick up on the depressive child, the child who's down, no energy, sleeping, and social withdrawal. And you can pick up on the child that's the behavior problem because they're always in conflict with you, parent. And then you can pick up on the child who has the anxiety. So my challenge to you, parents, is to stop and think. I challenge you to stop and think, parents. I challenge you to stop and think and to evaluate your current situation or your current relationship with your child or with multiple children that you have. Because you are responsible for your life, parent. You are responsible for your teens or your children's life. So I challenge you, parents, to make responsible choices. I challenge you, parents, to model yourself after friends or families that have proven themselves to be successful. So based on my challenge and based on you modeling the behaviors that you're trying to get your child to model, together we can raise successful children. Thank you for your time and attendance. You can give me a call at 731-285-1393 or cliff.nathaniel@wth.org. Thank you for your time.